This presentation is about imaging the choroidal vasculature with laser Doppler holography. So the ocular circulation comes from the ophthalmic artery, which branches into the central retinal artery to supply the retina, and also into several posterior ciliary arteries, which are the supply to the choroid. And because they are differently organized and they serve different purposes, it's necessary to study separately the retinal and choroidal vasculature. Now, when light reaches the eye fundus, it first goes through the retina, supplied by retinal vessels, then it goes through the RP and photoreceptors, and finally it reaches the choroid. And the choroid is particularly challenging because of this upper-lying RP and photoreceptor, which are going to scatter and absorb a lot of the light. So the instrument depth of field, laser Doppler holography depth of field, is large enough to encompass both the retinal and choroidal vasculature. But in this presentation, we're just talking about the choroid and the contrast that we can have in the choroid thanks to laser Doppler holography. So, as I said earlier, the choroidal vasculature is very challenging to image because of the RP, and this is in the same eye a comparison of what you can have with commercialized instrument and laser Doppler holography. So with laser Doppler holography, you can see many vessels that belong to the choroid that you cannot see with the other two images, and that is because the contrast, just based on reflectivity and absorption of the eye fundus structure, is not able to reveal the inside of the choroid. Okay, so what is the state of the art to image the choroid nowadays? Well, it's first indocyanine green angiography, which has been there for a long time, and it's useful because it's able to reveal differently arteries from veins, but it's not quantitative. So as always, blood flow is not quantified in physical units. It's invasive, which can be unpleasant and unsafe, and what is very problematic is that it's operator dependent, meaning that it's unreliable. You're never sure that you're gonna get the same image twice, especially of the arterial timing with ICG angiography. The choroid has also been studied quite extensively by OCT. Using the OCT scans, you can assess the thickness of the choroidal compartment quite reliably, but this thickness of the choroid has not been found to be able to assess or even reflect perfusion. And finally, Swepsos OCT with this commercialized Plexelite system has recently been able to show that you can reveal choroidal vessels, but unfortunately on these images you don't have any flow measurements, you don't have any vessel discrimination. So although you can see the choroid, the images are quite hard to interpret. So in this presentation, we're showing a lot of comparison between laser Doppler holography, indocyanine green angiography, and optical coherence tomography. And we are looking into what kind of contrast we get for what type of vessel. Right, so starting with laser Doppler holography, in our current implementation of the instrument, the field of view is quite reduced to just 3 or 4 millimeter. So in order to have a field of view that is relevant for the choroid, we had to stitch multiple subfield of view. So here is the 5x5 stitching, and it amounts to a field of view that should be about 10 or 12 millimeter, and you can see many choroidal vessels below the retinal vessels, which is quite coherent with the fact that the choroidal perfusion is supposed to be like something like 80 or 90% of the eye fundus perfusion. So we first made a comparison with ICG angiography, and this is the result, and we were quite surprised because we expected both of the image to reveal the choroid, so we expected the same contrast to see the same vessels, and here both images reveal the choroid, but you don't see the same vessels on the left and right images. And the answer came by looking at the dynamic ICG angiography. So as the contrast agent first propagate into the arteries, then capillaries, then in the veins, you reveal arteries and veins separately. So here, if you pay attention, you see first choroidal and cilioretinal arteries, choroidal veins, and finally the retinal veins. So if you take two images of the early ICG injection and late ICG timing, you will see first the arterial phase and the venous phase. And that's how we identified that with laser Doppler holography. It was more the choroidal arteries that we were able to show, which was very nice for the instrument, because with ICG it's quite hard to reveal the arteries. They are just revealed over a few seconds and not with a good contrast. Then we made a comparison with swept source OCT, and the advantage of OCT is that you have axial sectioning, so you have a 3D reconstruction of the eye from the structure. But the comparison with LDH was this time less trivial, because you can see some vessels in common, but many vessels not in common on the two images. And the reason is that with LDH you reveal mostly choroidal arteries, and with swept source OCT the vessels that appear are, well, the largest vessels that are on top of the choroid as they hide the one below them. So to summarize what we saw with these three imaging modalities is that with LDH we found that it efficiently reveals choroidal arteries, ICG we found efficiently choroidal veins, and OCT, as it reveals the largest vessels that are on top of the choroid, it's mostly the veins actually. But this is not the end of it. As with laser Doppler holography, we have a way to make a Doppler analysis in order to see more vessels and make a functional contrast that allows to separate arteries and veins. So this is a movie at a fixed point in time for different frequency ranges. So we show the power Doppler over different frequency range, and you see you don't see the same vessels for the lowest frequency range as for the highest frequency range, which means that you have vessels with the same size, and although they have the same size, they don't have the same flow velocity at all. So by making an image at low frequency for the power Doppler of 2.526 kilohertz and let's say 10 to 30 kilohertz here, we're able to show that it's not the same vessels that are apparent for these two frequency ranges at all. So when we combine these two frequency range by a color composite scheme, so we add in blue, in cyan, the low frequency range, and in red, the high frequency range, we have arteriovenous differentiation that is quite clear. And the comparison is striking with ICG angiography. So where ICG, this is the venous timing, so we are sure that only the choroidal veins are revealed, and these are the vessels that you see in blue with laser Doppler, and the vessels that you see in red with laser Doppler, which is the artery, you cannot see it with the ICG angiogram. And this is the comparison with also swept source OCT, and this time again it's not very trivial to say what vessels you can see on LDH and those you can or cannot see with swept source OCT, but the thing is that adding this functional contrast of flow velocity, blue, cyan is the low velocity and red the high velocities, it brings something very nice to the contrast of images. Right, so what is the reason behind this arteriovenous differentiation based on the velocity? Well, it's due to the particular organization of the choroidal vascular network. So if you take the retina, or basically most of the other vasculature of the body, arteries and veins are built symmetrically. So if you take side-by-side artery and vein, they will carry the same amount of flow in both directions. But in the choroid, you have the arteries coming in the central region, and blood flow is evacuated by the vortex vein in the periphery. So unlike the retina, if you take a side-by-side artery and vein, blood flow will run in the same direction, and this time you will have in the central region arteries being very large, carrying a lot of flow, and then that just start to accumulate a little bit of flow and that are very small. So that is the reason why they have different velocities in the central region. And that is the reason why when we make this color composite contrast over an extended field of view in the central region, we have an arteriovenous differentiation that is quite reliable and interesting to see compared to ICG angiography and swept source OCT. So what do we see exactly with laser Doppler holography? Well, to study that question, we made a comparison with SD OCT. So we looked at the area where we see the choroidal arteries emerging, at least with this red contrast here. And at this area, we were able to identify the short posterior ciliary artery coming in from the sclera into the eye. And as the artery branches into different other sub-arteries, we were able to find their location at the eye fundus. So despite the fact that these arteries are located at the bottom of the eye, at the bottom of the choroid, we're able to see them with a nice contrast. And we're able to see them about up to the point where the arteries branch into arterioles. So we're able to follow the flow in choroidal arteries from the short posterior ciliary artery up to the arterioles. And this allows laser Doppler holography to have a really nice contrast compared to ICG and swept source OCT in the central region. So with ICG here it's the venous timing, so of course you don't see the choroidal arteries, and with swept source OCT, well, you don't see the arteries with a very nice contrast. And what's interesting to notice is that in this central region we don't see veins with laser Doppler holography, and the vessels that appear in cyan, they are not veins but they are actually arterioles, and we are certain they are arterioles as they cannot be venous because we don't detect the veins. So as the flow in the venules would be even lower than the one in veins, we cannot see them. So just a quick comment on the pulsatile blood flow that we can see in the choroid. What's very curious is that we measure pulsatility that is quite lower as the one in the retina. So here's a comparison in retinal artery in red, retinal vein in blue, and choroidal artery in purple. And the fluctuation normalized by the average value are way lower in the choroid than in the retina. So to this day we don't really know whether this is an artifact or that is a reality, as it might be that the multiple scattering in the choroid induces sort of an offset value that shifts the signal towards higher value and induces lower variation, relative variations. But it might also be that the resistivity, the vascular resistivity in the choroid is lower than in the retina, so it could also lead to lower variation. And the reality is probably a combination of these two factors, but the fact is that the retina and the choroid are not in the same layer, so we're not able to compare directly the blood flow fluctuations. Okay, and to finish, just a few examples of contrast we can have in the choroid with LDH. So on the right, this is an image from a commercialized instrument, and we're looking at two different regions of interest where we can see both vessels from the retina and choroid and arteries and veins, and it's not possible to say what is what. And when we add the functional contrast, so image in the middle is contrast based on the pulsatility, on the variations of blood flow over the course of cardiac cycle. And because we demonstrated that in retinal arteries we have larger variations, then they appear in red, and retinal veins appear in blue because they have low relative variations, low coefficient of variation. And by using this color composite contrast that we introduced in this presentation, we're able to see that choroidal arteries are visible with a red contrast because they have a very fast flow, and choroidal veins have a very slow flow, so they can be identified in cyan. So this is based on the flow velocity as in opposition as the image in the middle that is based on the contrast of pulsatile variations. And it's very advantageous for laser Doppler holography to be compared to ICG or sweep-source OCT thanks to this functional contrast, as you don't make any sort of discriminations of flow with sweep-source OCT, and with ICG you just have this arteriovenous differentiation, but it's quite hard to realize. And what it means is that this ability of LDH to measure blood flow, although in arbitrary units, but still the fact that it's semi-quantitative, it allows to compare blood flow in adjacent vessels, or it allows to study the variations of blood flow over a cardiac cycle, and this ability allows to bring a functional contrast that is very useful to interpret the images. Okay, and just a few examples in health and disease, well, mostly disease, I think, probably mostly AMD. Well, what you can see is that the differentiation of artery and vein in the choroid is very robust. Okay, in conclusion, we demonstrate with LDH a non-invasive imaging of the choroidal vasculature and the ability to make a differentiation of arteries and veins based on their flow velocity. The contrast is especially nice for the arterial vasculature of the choroid, and we are able to detect and image the choroidal arteries from, well, the PCAs till the arterioles. So that's it for this presentation, and thank you for your attention.